Welcome to my channel Learn Maxillofacial Surgery. Today I'm going to show you a very simple case of taking out a sialolith from an intraoral approach. This patient used to get recurrent swellings in the neck, and she used to get extensive amount of pain and swelling every time she ate some food. So a common radiograph was done, and there was a suspicion that there was a stone. So we got a CT scan, and in the CT scan you can see that there is a sialolith in the Wharton's duct, which is the duct of the submandibular salivary gland on the left side. So it's a good idea to get different sections in the CT, the axial, the coronal and the sagittal sections. That's the axial section which you can see there, and you can see the stone, a large stone, and this is basically the coronal section, and on the sagittal also you can see here. Clinically you can palpate quite deep sometimes. Many a times you can feel the stone very easily, but if the patient is obese, then it could be a big problem in palpating. Before you do the surgical procedure, it's a good idea to take a stay stitch behind the stone, palpable stone, and basically this is to prevent the salivary stone to slip back. Many times when you're dissecting, it can go back, because what would have happened is the duct would have got dilated, and because of the force of the saliva, the stone would have been pushed almost to the anterior part of the floor of the mouth. So good idea to put this stitch, and also this will help in elevating the floor and giving a bit of traction when you are doing the surgery. So that is where, parallel to the duct in the floor, you make your incision using a 15 blade, and you need to ensure that you can palpate the stone, feel as you go along, and there you can see something which looks like a stone, and once you see that, you can just make a nick, and without any effort you can see the way in which a large stone has just popped out. This is the key. So the moment you make a nick, you can see the white structure. It looks almost like a tooth. That is the shape of the duct it would have taken, and that's the thick mucus which is coming out when you milk the salivary gland, the submandibular salivary gland. So it is important that you basically, many times there could be multiple stones, so when you palpate and when you put some pressure on, you can basically milk all these things out. Then it's a good idea to take a bite from the mucosa into the duct, basically one wall of the duct which we would have incised, and on the opposite side also it's like marsupialization which we do, so that the flow of saliva can happen. Again, a good idea to irrigate the duct so that whatever pus or whatever is there can come out. And leave it. You don't have to do a primary closure. Just allow the saliva to basically expel out, and it generally finds its own path and a new opening forms. And that's the stone which you're seeing there. It's almost about 15 millimeters and about 4 millimeters in width. So it's a large stone. Once the stone is removed, then the patient becomes totally asymptomatic. The neck swelling will go off, and he is, normal, back to his normal activities. So thank you so much, and I'm sure every maxillofacial surgeon will be able to take out these sialoliths.